Hi, my name is Taylor Graves, and I'm a family nurse practitioner student at Eastern Kentucky University. This project proposal will explore the Internet's influence on depression, which is a significant clinical nursing problem today. Depression is a huge health problem that advanced practice nurses are sure to encounter within their practice. It is considered one of the most common mental health disorders in the United States. If granted approval, this project will answer the question, in young adults diagnosed with depression, how does participating in web-based interventions compared to usual care affect depression occurrence measured by the CESD scale within 3 months of implementation? The objectives of this project include to determine the effectiveness of a web-based intervention on the occurrence of depression in young adults as measured by the CESD scale within 3 months of its implementation. It is perceived that evidence of depressive symptoms will be lessened after a participant's successful completion of this intervention. Results of this study will be incorporated into advanced nursing practice to improve the health outcomes of all populations that they serve. The background and significance of this clinical health problem include that in 2016 alone, over 16 million adults were affected by a major depressive episode in the U.S. These occurrences were highest among individuals aged from 18 to 25 years old, or young adults. There were several studies explored to gain insight into this clinical problem. Sargent and Mongrain studied effects of a web-based intervention on decreasing depression in pessimistic individuals and revealed a reduction in depressive symptoms measured by the CESD scale in the optimism group and decreased dysfunctional attitudes. Linvet et al. Determined that an internet-based self-help intervention could lessen depression symptoms and negative thoughts among a population of university students that had psychological stress. Harrer et al. Found that internet-based interventions in university students helped to lower stress levels and, as a secondary result, decreased depressive symptoms. Hirsch et al. Determined that an online intervention could improve depressive symptoms among employees that were at risk for depression. In this project, methods will include determining the effectiveness of a web-based intervention in decreasing depressive symptoms in young adults based on the CESD scale over a 3-month period. Participants will be recruited through informative flyers that are hung through highly trafficked areas at EKU. Once participants are chosen, they will be randomly assigned to either an intervention or a control group. Participants in the intervention group will gain access to a website that evaluates one's psychological state and their severity level of depression. It will also provide information on depressive symptoms, effects of depression being left untreated, and how or where to seek help. Initially, a survey or questionnaire will be provided to participants related to depression and what symptoms the individuals are experiencing. Later, study outcomes will be evaluated throughout the process and then thoroughly with a post-study survey and the CESD scale upon completion of the intervention. Outcome measures of this project include the study outcomes will be evaluated lightly once again through the process, and then a CESD scale will be used to measure depression symptoms upon completion of the intervention. The CESD scale consists of 20 self-reported items. Each item is scored on a 4-point scale with a range of 0 to 60, with scores greater than 16 being considered depressed. Following the completion of the study and results being evaluated, individual participants will be notified of their progress via email and then be instructed on what their next steps should be to seek help. If successful, study results are warranted. Study will be published for other researchers to see and shared with physicians' offices. The implications and conclusions of this project include, according to Child Trends, the time between the ages of 18 and 29 are trying times and pose an increased risk for mental health disorders on young adults. In this age group, depression usually peaks due to young adults having to make so many life-changing decisions. It is important for advanced practice nurses to incorporate the findings of these studies into their practice because advanced practice nurses should implement current evidence-based practice guidelines into their practice to promote the well-being of those that they serve. Thank you for watching my project proposal, and I hope that you will grant approval. If you have any questions, please email me. Thank you.